So think about your typical workday for a second. What if, what if the eye rolling, the passive aggressive emails, the general workplace drama you deal with every single day isn't just, a typical HR headache?
Right.
What if that behavior, which we honestly mostly just write off as the cost of doing business, is actually a $300 billion public health crisis?
Yeah, I mean, it really forces a complete rethink of how we operate because for decades, the corporate world has treated psychological harm as basically, well, an inevitable byproduct of a competitive environment.
Like it's just normal.
Exactly. You get a paycheck, and in exchange, you might get a little bruised. But the clinical data we are diving into today, it demands a massive paradigm shift.
Right.
We have to start treating psychological safety with the exact same rigor and the exact same infrastructure as physical workplace safety.
And that is exactly our mission for this deep dive. So we are unpacking an incredibly comprehensive academic paper today. It's titled Workplace Bullying is a Public Health Issue.
It's a fantastic paper.
It really is.
Yeah.
And we're going to explore the hard science behind workplace bullying, understand the biological and the financial toll it takes, and look at the evidence-based strategies that organizations can actually use to stop it.
Right.
And this research approaches the issue entirely through a public health lens. So it's not about finding a few bad apples. It's about recognizing a systemic infection that requires a systemic cure.
Yeah. And to even begin treating that infection, we have to isolate what we are actually talking about. Because, I mean, we use the word bullying so casually now.
We really do. And to be clear for everyone listening, the clinical definition of workplace bullying isn't just an isolated conflict.
No, not at all.
Like if a manager snaps at you during a high-pressure meeting because they're just having a terrible day, that's, poor management. Maybe a bit of a toxic moment. But it's not bullying.
Right. For behavior to actually cross that threshold, researchers look for 3 specific elements working together. You need repetition over time, a power imbalance, and a perceived intent to harm, or at least like a reckless disregard for the harmful impact.
And that power imbalance, that's really the engine of the behavior, right?
It absolutely is. It completely distinguishes bullying from a standard peer-to-peer conflict. Like if you and a colleague of equal standing argue over a project, you both have relatively equal footing to push back.
Sure.
But bullying relies on asymmetry. And the thing is, that power doesn't always have to be structural, like a boss harassing a subordinate.
Wait, really? How else does it show up?
Well, it can be informal. It might stem from someone's specialized expertise or their deep social networks within the office, or even just their tenure. That asymmetry makes it nearly impossible for the target to defend themselves without risking severe professional or financial retaliation.
Oh, wow. Okay, that makes sense. And the way that power is weaponized, I mean, it exists on this huge spectrum. We all know direct bullying.
Yeah, the obvious stuff.
Right. Yelling, public humiliation, aggressive and personal criticism in front of an audience. But the indirect bullying is what really caught my attention in the paper because it is so heavily normalized in office culture.
It really is. Indirect bullying operates completely in the shadows. It's the systematic withholding of vital information you need to just do your job.
Ugh, the worst.
Or it's social isolation, where you are suddenly excluded from key meetings. It's setting completely unrealistic work demands designed to just make you fail, or quietly planting seeds of doubt about your professional reputation behind closed doors.
Yeah.
And, digital technologies have weaponized this even further. We are seeing entirely new vectors like persistent surveillance through messaging platforms, intentional exclusion from crucial email threads, or weaponizing digital documentation to build a fabricated case against someone.
Okay, let's unpack this with a visual for the listener. Because if a sudden, explosive argument is like a fire in the break room, it's obvious everyone sees the smoke, and it demands an urgent response. Indirect bullying is like a carbon monoxide leak.
Oh, that's a great way to put it.
Right. It is invisible, it builds up slowly over time, and the targets usually don't even realize they are being poisoned until they are already seriously ill.
The carbon monoxide analogy actually maps perfectly onto how the academic community is currently reframing this whole issue.
Oh, really?
Yeah, so Walker's 2026 reconceptualization in the text aggressively challenges our old assumptions. For years, companies viewed these behaviors as interpersonal disputes that just needed a little, conflict mediation.
Just talk it out.
Exactly. But Walker argues we need to strip away that sanitized language and classify this behavior for what it actually is, which is workplace violence.
Workplace violence. I mean, calling it that sounds really intense at first.
It does.
But when you look at how prevalent it is, the public health framing makes total sense. We are talking about massive exposure rates here. The converging evidence places the prevalence of workplace bullying at 25 to 30% of workers over the course of their careers.
Which is huge.
It is. And right now, at this very moment, 10 to 15% of the global workforce is actively experiencing it.
Think about that. That means 1 in 4 people listening to this deep dive has been or will be a target. And researchers constantly warn that these figures are likely severe underestimates.
Because people are afraid to say anything.
Exactly. It's driven by the target's completely rational fear of retaliation if they actually speak up.
And while this gas leak can happen in any office, certain industries are absolute breeding grounds for it.
Oh, absolutely.
Healthcare workers, for example, face astronomical exposure. The studies document prevalence between 30 to 50% among nurses and physicians.
Yeah, half the workforce in some cases.
Right, and education is another major hotspot, especially for faculty navigating that cutthroat tenure process or adjunct instructors who are trapped in precarious contract-to-contract roles. And you also see heavy exposure in the public sector and social services.
And the common thread across those high-risk zones is the organizational environment itself. Bullying thrives in environments plagued by role ambiguity.
Where nobody knows who is actually in charge of what.
Exactly. Where job descriptions and boundaries are constantly shifting. It also thrives during times of organizational change, like corporate mergers or massive restructuring.
That makes sense, yeah. High stress.
Right. But the most consistent predictor, like the ultimate accelerant for workplace bullying, is actually leadership style, specifically laissez-faire leadership, where managers just turn a blind eye and refuse to intervene, or highly autocratic management styles. That is what allows everyday workplace friction to basically curdle into systemic abuse.
Okay, wait. I need to challenge this just a bit to make sure we are drawing the right lines here for the listener.
Sure, go for it.
Because if I'm in an incredibly high-stakes environment, say I'm an attending physician in a trauma ward, or I'm a director navigating a multi-billion-dollar corporate merger, that environment is naturally going to be intense, right?
Without a doubt.
People are going to be sharp. They're going to be demanding. So how do we separate the necessary urgent intensity of saving a life or closing a deal from actual bullying? Like, are we just sanitizing the workplace so much that any harsh feedback gets labeled as abuse?
No, it is a critical distinction, and the data separates the two by looking really closely at that core element we mentioned earlier, power asymmetry and intent.
Okay.
It's never the intensity of the work itself that causes bullying. It's the abuse of power within that intense environment. So an attending physician sharply barking a necessary command to correct a life-threatening mistake, that's situational urgency.
Right, they're just doing their job.
Exactly. But that same physician repeatedly mocking a specific resident's intelligence in front of patients or intentionally assigning them impossible shifts just to force them out of the program, that is bullying.
Got it.
One is about the work, the other is about asserting dominance and inflicting harm.
Okay, so the intense work is really just the backdrop. The bullying is a separate predatory behavior utilizing that backdrop.
Perfectly said, yeah.
And because of those power dynamics, certain people are systematically left more vulnerable than others in these environments. The data shows women, racial and ethnic minorities, LGBTQ+ workers, and whistleblowers face compounding disproportionate risks.
Yeah, and we also see massive risk for those in precarious employment. So temp workers, probationary employees, basically people who literally cannot afford to rock the boat.
Because they could lose their livelihood in a second.
Exactly. And the manifestation often shifts based on demographics, too. Women, for instance, report bullying at rates equal to or higher than men, but the form often leans heavily into those indirect vectors we talked about.
Like the social exclusion and rumor-mongering.
Yes, reputation damage, which, is much harder for HR to formally track than someone just yelling in a hallway.
Right, because it's invisible. So when you lay out all those environmental triggers and vulnerabilities, you really start to see how inescapable it feels for the target. You are literally trapped in a room with the carbon monoxide.
You really are.
And that inescapability is exactly what triggers the biological cascade. Because the physical damage of weathering this storm is shocking. This isn't just about feeling sad on Sunday night before the work week begins.
Not at all. The health consequences definitively meet clinical thresholds for significant harm. I mean, meta-analytic research shows that targets of bullying suffer mental health impairment on par with populations experiencing major life-altering trauma.
Which is a huge statement to make.
It really is.
44% of targets meet the diagnostic criteria for clinical anxiety disorders.
Yeah.
44%. Compare that to the standard 12 to 15% in non-bullied populations.
There's a massive jump.
And depression rates skyrocket by a factor of 3 to 4. But the psychological damage is really just the first domino to fall, isn't it?
Yeah, because the chronic psychological distress violently impacts the physical body.
Yeah.
Systematic reviews definitively link workplace bullying to elevated blood pressure, adverse cardiac events, and just an overall increased risk of cardiovascular disease.
So let's break down the mechanics of why that happens for the listener. Because it's not just some vague mind-body connection. When you are being systematically bullied, your brain's threat detection center, the amygdala, it doesn't know you were just sitting in a status meeting.
Right. It can't tell the difference.
It registers a literal threat to your survival. So it dumps cortisol and adrenaline into your bloodstream. Your body goes into a full fight or flight state, but you can't fight your boss, and you can't run out of the conference room.
No, you have to sit there.
Exactly. Just sit there marinating in stress hormones.
And when you are exposed to that dynamic repeatedly, week after week, that stress activation becomes chronic. Your baseline cortisol levels dysregulate entirely, widespread inflammation takes hold in the body. You are essentially asking your cardiovascular system to operate at redline constantly.
Which you can't do forever.
No. And that leads directly to the crucial mediator in all of this, which is severe sleep disorders. They affect 60 to 80% of targets.
60 to 80%.
Duh.
Because your body still thinks it's being hunted.
Precisely. You go home, you try to rest, but your nervous system is vigilantly scanning for the next attack. And when you can't sleep, your body loses its ability to repair cellular damage, which rapidly accelerates the cardiovascular and cognitive deterioration.
Oh.
And this physiological breakdown culminates in probably the most grim reality found in the data. Severe workplace bullying predicts suicidal ideation, with odds ratios ranging from 3 to 6 times higher than normal populations. And that's even when researchers control for prior mental health conditions.
That is just heartbreaking. And here's where it gets really interesting and honestly kind of terrifying for you listening. This doesn't stay at the office. The trauma doesn't respect the boundary of the office parking lot.
No, it doesn't.
The research highlights a documented intergenerational spillover effect. Children living in households where a parent is being bullied show significantly increased behavioral and emotional difficulties.
Yeah, it spreads.
Because kids are incredibly perceptive. They pick up on the micro-expressions, the emotional withdrawal, the exhaustion. The toxic workplace literally hitches a ride home in your nervous system and infects the entire family unit.
It ceases to be just an occupational hazard and becomes a full-blown community health concern at that point. Yet, despite the massive human suffering, the organizational drain is unfortunately what usually forces the C-suite to finally pay attention.
Of course it is.
Yeah.
It always comes down to the money.
Sadly, yes. We are looking at a $300 billion annual drain in the U.S. economy alone.
$300 billion.
Yeah.
Because targets of bullying use sick leave at 2 to 4 times higher rates than their peers, right?
Right. And even when they drag themselves into the office, you have massive rates of presenteeism.
Where someone is physically at their desk, but mentally just paralyzed by distress.
Exactly. And that causes a 30 to 60% drop in raw productivity.
Wow.
Then you factor in the turnover. Replacement costs range from 50% to 300% of an employee's annual salary, depending on their level of specialization.
That is astronomical.
It is. Add in the legal defense costs, the workers' compensation claims, and the lasting, sometimes permanent damage to an employer's brand in the talent market. The financial bleeding is just catastrophic.
So if companies are hemorrhaging billions of dollars and employees are suffering literal cardiovascular damage, the traditional just talk it out in HR approach is clearly a spectacular failure.
Oh, completely.
A generic anti-bullying poster in the break room isn't stopping a public health crisis. So what does the evidence say actually works?
Well, effective intervention requires dismantling the systemic enablers.
Yeah.
You have to move past the Band-Aids. The research emphasizes that organizations that successfully reduce bullying incidents, they start by implementing transparent multi-channel reporting systems.
Right, and the Cleveland Clinic Speak Up program is a brilliant case study of this in action. They completely overhauled their system to include multiple reporting channels. So they had anonymous hotlines, dedicated ombudspersons, web portals, and in the very first year, reports of unprofessional behavior shot up by 250%.
And that spike in reports is actually the marker of a successful intervention.
Right. The behavior didn't suddenly get 250% worse. People finally trusted the infrastructure enough to actually use it.
Exactly.
The clinic paired those reporting channels with crystal clear communication about the investigative process and guaranteed standardized response protocols, which leads right into one of the most fascinating psychological concepts in the research procedural justice.
Yeah, procedural justice is so crucial. It's the perceived fairness and transparency of a decision-making process. It turns out how an organization investigates a report matters just as much, biologically speaking, as the final outcome of that report.
That is so interesting.
Pixar Animation Studios provided a great real-world example of this. When they faced concerns about creative team dynamics and potential toxic behaviors during a leadership transition, they didn't just route it through their standard HR department. They brought in external investigators.
Because let's be honest, employees know that internal HR ultimately works for the CEO.
Oh.
They are there to protect the company's liability. Bringing in external reviewers removes that inherent conflict of interest.
And that removal of bias is what creates procedural justice. Think about how we are wired as social primates. We have a deep psychological need for fairness.
We really do.
Meta-analytic research shows that having a fair, impartial, and timely investigation actually acts as a biological buffer against the negative health effects for the targets.
Wait, a biological buffer?
Yeah. Even if a target doesn't get the exact disciplinary outcome they wanted, like maybe the bully isn't fired, but just reassigned, if the target firmly believes the process was transparent and their voice was genuinely heard, their mental health outcomes improve by 35 to 50% compared to those who navigate a corrupt or opaque process.
That is wild to think about. The integrity of the process itself is literally part of the medical healing.
It is.
But you also had to train the workforce to interact differently, right?
Yeah.
The Department of Veterans Affairs implemented a program called Team Step PS.
Yes, that's a great example.
They took a framework originally designed to reduce patient safety errors during surgeries, and they adapted it specifically for staff interactions. They trained their teams on emotional intelligence, conflict de-escalation, and identifying power dynamics in real time. And it resulted in a 30% reduction in staff-reported conflicts.
It's highly effective because it moves far beyond vague awareness campaigns. It builds specific, rehearsed behavioral capabilities.
Yeah.
And when an organization fails to prevent the harm, they need restorative interventions. The UK's National Health Service created a dedicated occupational health pathway specifically for targets of bullying.
Really? How does that work?
They treat it like an on-the-job physical injury. Targets get fast-track access to cognitive behavioral therapy, combined with practical, immediate workplace accommodations. So like schedule adjustments or altering the reporting structure so they no longer have to interact with the perpetrator.
Oh, that makes so much sense.
You cannot just treat the trauma, you must simultaneously alter the environment that actually caused it.
So what does this all mean? If we pull all this together, it is essentially the evolution of industrial safety. 100 years ago, factory workers were losing limbs in heavy machinery, and the response was, well, be more careful.
Right. Just pay attention.
Exactly. Now, we don't tell factory workers to just dodge the falling anvils or develop a thicker skin. We build physical guards on the machines, we engineer the danger out of the workflow, and we distribute safety accountability across the entire factory floor. We have to engineer our offices for psychological safety in the exact same way.
And that engineering requires cross-functional ownership. You cannot just dump this onto the HR department and wash your hands of it.
No way.
Preventing workplace violence requires the deep integration of HR, risk management, occupational health, and legal departments. Google's Project Aristotle proved this years ago. They demonstrated that psychological safety, which is the foundational belief that you can speak up, admit a mistake, or challenge an idea without fear of humiliation or retaliation, is the single most important metric for team effectiveness.
And they treat it as a hard business metric.
They do?
If a manager is hitting all their quarterly financial targets, but their team's psychological safety scores are in the basement, that manager is recognized as a massive long-term liability. Organizations have to make psychological safety a core leadership competency with actual, tangible performance consequences.
It requires a fundamental shift in how we evaluate organizational health. We have to stop viewing friction as fuel and start recognizing chronic intimidation as a systemic failure.
Which brings us to the ultimate takeaway for you listening right now. The clinical evidence is unambiguous. Workplace bullying is a completely preventable public health threat.
Absolutely.
Think about how society used to view tobacco use, or driving without a seatbelt, or impaired driving. We used to treat those things as personal choices or inevitable realities of life. Then the public health data became too overwhelming to ignore, and we changed the infrastructure of society to protect people.
We did.
We have to do the exact same thing for the modern workplace. So take a hard look at your own organization. Do you have multiple trusted reporting channels? Is there a culture where you can raise a legitimate concern without fear? Or is it a culture built on status-based intimidation?
And as we look to the future, the research leaves us with a highly provocative question regarding those digital vectors we discussed earlier.
Yeah.
As we transition deeper into the era of AI-managed workflows and fully asynchronous remote work environments, how will the invisible vectors of indirect bullying evolve?
That's a scary thought.
It is. Will our current organizational risk assessments be entirely blind to a manager who subtly weaponizes task assignment algorithms to set someone up to fail, or who selectively isolates an employee in virtual spaces where there are no physical break rooms for anyone to notice a colleague sitting all alone?
That carbon monoxide isn't just in the office anymore. It might be coded directly into the workflow. Thank you for joining us on this deep dive. Keep questioning the systems around you, and remember, just because the X-ray doesn't show the break doesn't mean the damage isn't real. Stay curious.